Now we focus on why political leaders can't seem to agree on masks. Governor Kathy Hochul telling us she plans to mandate masks for anyone in a school building. CBS 5's Mary Keeler reports.
Governor Kathy Hochul at the New York State Fair Sunday answering my questions about her expected mask mandate for schools and how she plans to carry it out legally and addressing pushback out there on the policy.
Are you expecting that you're going to need some sort of power, emergency power from the legislature or another body to carry out the mandates that you might want?
I have the authority through the Department of Health to offer, to recommend, and to in fact require that students and anyone entering a school wear a mask. Yeah, there's been opposition, but I make my decisions based on the circumstances before me and talking to experts. From Dr. Fauci on down, I've consulted with the best and the brightest in this country, and I feel confident in the decision we've made that will protect the lives of our citizens, those who work in a school and those who attend a school.
Central New York Republican congressional reps Claudia Tenney and John Katko together on Monday in Rome, touring an Air Force research lab. I asked Tenney about her stance on Hochul's decisions with masking.
And then you put out a statement on July 28th and you said parents know what is best for kids and children 2 and above should not be forced to wear a mask, as the CDC is now recommending. Do you still stand by what you say there? Has anything changed in your position there?
No, I stand by this. This is up to parents to make decision how to raise their children. It's not up to people who are in government to put people in a position where their children are being forced to wear masks.
You will not support her on that?
I don't support what Kathy Hochul is doing. She's actually continuing all the failed policies of Andrew Cuomo on the mask mandate. Now we're looking at probably vaccine mandates. They're not doing anything about trying to use therapeutics and other ways to minimize the impact of this disease.
You and Governor Hochul both work for constituents.
Yes,
so
that's what
can
it's
you
about,
put your
and she's
differences
hurting
aside,
them.
though?
She's hurting constituents. That's what it is all about. That is what it's all about. It's not about politics. It's about the constituents.
Republican Congressman John Katko also does not agree with what Governor Hochul is proposing.
I think you got to leave it to the local leaders that are with the boots on the ground and let them make those decisions. I think top-down decisions should be is not the way to go. I think that whatever the local school districts feel, whatever local political leaders feel, should based on what they're seeing and what they think is best for their children is what they should do.
The New York State Fair got going last week, 10 days ago or so, in the wave of that Delta variant of COVID cases climbing in our region. And there's even more concern now as those cases keep going up and hospitalizations also are on the rise. Here's a look at the latest numbers from Onondaga County, including the weekend numbers. 140 new cases Saturday, 123 Sunday, 62 new cases today, a typical low reporting day coming off the weekend. Hospitalizations have now reached levels we haven't seen since last February. So we went to county health departments across central New York to find out where are the cases coming from. Our Connor White joins us live here at the fairgrounds with more on that tonight. Connor?
Matt, the New York State Department of Health says that so far of the 923 tests conducted here at the fairgrounds, 24 people have tested positive, though that doesn't necessarily mean that they contracted the virus here at the fairgrounds. It's in line with what we've heard from county health departments throughout central New York, who say that so far there's no evidence linking big events like this one with the recent spike in cases. More than 100 people are in hospitals across central New York for the first time since February.
Majority of our cases are what we label community spread. They don't know where they got it in the community.
The Madison County Health Director says investigators only know of one person who was at the fair before testing positive, but they don't know where the person actually contracted the virus. Madison County now has more than 100 active cases for the first time in 6 months. But why is just not an easy answer to come by.
Seems kind of strange. We're not seeing any particular trends. We're just seeing a number go up.
We got similar answers from Oneida, Oswego, and Onondaga counties. The Onondaga County Health Department issued a statement to CNY Central saying, in part, the majority of cases have identified multiple potential community exposures.
It's not surprising that with those freedoms that came back, if you will, and the infectiousness of this new variant, that kind of it took off.
Vaccination data in Madison County is encouraging. Of the 43,150 neighbors fully vaccinated, just 104 have tested positive. That's about 2.4% of the vaccinated population. Of those, just 2 ended up hospitalized, both later discharged.
Both of those individuals were over 80 years old. So the vaccine works is what I can say there. It's working. It's keeping people out of the hospital.
The health director says while they haven't identified any specific clusters here at the fair or other events like concerts that have been going on this summer, they say that it may be too early to tell for sure whether or not the fair is causing a problem. We may see more cases down the line in just a couple of weeks.
Matt, more than 100 people are in central New York hospitals fighting COVID-19, which is a number not seen since February. And with increasing COVID trends, I wanted to see if people are changing their day-to-day routine to keep themselves safe.
Well, I'm confident, but again, I take it upon myself to be on guard.
COVID-19 cases in central New York are higher than what they were months ago. Madison County with more than 100 cases for the first time in 6 months. Hospitalizations also reaching levels not seen in some time. Just last week, Oneida County saw numbers that matched its April surge. Local health departments aren't singling out one thing as to why that's happening. So are people more cautious when they go out?
If I find myself in a crowded situation, I take it upon myself to put a mask on.
I went to Onondaga Lake Park today to find out. People I spoke with say things like the state fair or concerts are not on their agendas right now.
For me, that going to concert like in the public, I advise not to do it right now.
While some may be a little more cautious, others feel confident they'll be okay. I also went live on Facebook to talk about it. Some commented, wear mask when asked in a business. Other than that, I haven't changed a thing. Nope, wide open, someone wrote. No, I'm living my life. Others sharing they are adding more safety measures to their day. Outside of home, wear masks when indoors, a viewer said. As recommended, I wear a mask indoors or in high concentrations of people. Still wearing my mask everywhere. And with kids starting school in a matter of days, some families still have a little bit of concern.
30% I'm not so comfortable.
While counties can't point to one specific thing as a factor in increasing cases, they're asking people to be smart with their choices.
Just going outside is different, and being in a crowded situation is, I think a good word is uncomfortable.
The Oswego County Public Health Director says while there are vaccinated people testing positive, the vaccine is still effective in preventing severe illness, hospitalization, and death, which is a number echoed in Madison County, for example, Matt, where of the more than 43,000 people vaccinated, only 2 have been hospitalized and both of which were discharged.